Good morning, everyone. Thank you for watching Atlanta and Company. I'm Christine Pilara. We have a great show on tap. You picked a good day to watch. Well, for more than a decade, Dr. Chapman has been making women all over Atlanta look and feel their very best, including me, by offering the latest advances in both medical and cosmetic skincare. From treating your veins to smoothing your wrinkles, Laser Med Skin and Vein Clinic turns back the clock with state-of-the-art procedures, and we're thrilled because Dr. Chapman joins me right now with more. Welcome back.
Hi, how are you?
I'm doing great, and I'm very excited to hear more about this Ulthera. I've read about it in different trade magazines, and you talked about it last time you were on the show, but for anyone who's new to this procedure, what is it?
Ulthera is a non-surgical and non-invasive ultrasound procedure, and it delivers a micro-focused ultrasound heat to create collagen and thus tightening and lifting in your skin.
So you're not only taking rid of getting rid of the skin in terms of tightening it, but I like that you're talking about renewing that collagen. So it seems like it's something that's going to kind of keep working after you have the procedure done.
Exactly. You get the procedure done, and sometimes you can see instant results as early as the next day, we've seen.
Wow.
Usually you get the best results about 3 months out. That's how long it takes for you to create collagen and elastin.
And how would you say it's different from other things that you've seen?
This is actually the only and the first device that penetrates down to where the fat and muscle layer and fibroelastic bands are. And when you get deeper, then you definitely get better tightening.
Absolutely. We're looking at some pictures right now. That beautiful jawline you can see right there on the right. It's really tightened up and firmed the skin right there. You know, as we get older, that skin gets slack. I know it's happening with me. I'm 43, and I guess, you know, it happens with most of us. It's just we lose that elasticity. And a lot of people, when I was looking at the video, I noticed that the skin gets pink. So people might be wondering, what are the side effects? Does it hurt?
Yes, there is some discomfort, and we did find the best way to take care of that is what's called nerve block. And since we've been doing that, absolutely everyone has found it very comfortable.
Okay.
And side effects, I'd say a little bit of tenderness, especially when you touch the bony areas, you'll feel some of that. But visibly, there's nothing to really show for.
And that's important because a lot of things that we've talked about in the past are going to require some downtime. You're not going to be able to go into work for a week. And a lot of us just don't have the time to do that. So this is, it seems like, a great procedure in that it's non-invasive.
Correct. We do combine this a lot of times with CO2, which does have some downtime. But if you'd rather not, then Ulthera itself has very little downtime, a little bit of swelling, a little bit of tenderness. And some people do get a little bruising from that nerve block, nothing severe, however. So it's a fairly minimally invasive procedure.
And you've mentioned that this, in conjunction with the fractionated CO2, just produces amazing results. That fractionated CO2 is an anti-aging breakthrough of the decade, they say. And tell us a little bit about that. We're looking at a picture right there that is just phenomenal.
That is one of the procedures I love doing along with Ulthera. Those two together, I have been so impressed with the results that we can offer to our patients at any age and with no surgery.
So the fractionated CO2, essentially, takes care of, let's say, the melasma and some of the skin discoloration, fine lines, all that, right?
Right. So if you compare the two, Ulthera and fractionated CO2, the CO2 is more of a actual skin rejuvenating resurfacing treatment. So anything, sun damage, the fine lines, the acne scars, enlarged pores, melasma, any of those will be resurfaced and your skin will be radiant and beautiful. Whereas the Ulthera works slightly different in the sense that it penetrates deeper and actually tightens and lifts your skin.
Got it. So it's just a perfect marriage since we're talking bridal week. And let's talk too about how many treatments are required. What would you say?
It is just one treatment.
You're kidding me.
I have had ladies in their late 60s and 70s that have had 2 fractionated CO2 and 1 Ulthera.
Okay.
However, most of the patients are going to be extremely happy with 1 each.
Oh, that sounds so nice. It's not something that you have to keep going through, a dozen times. Right. And who is the perfect candidate? What age range? What would you say?
I've had patients as early as in their mid-30s, and I have treated a lady in her early 80s.
Okay, wow. Well, just to show that picture that we showed of the older woman, she looks like she might be in her 60s, but the after, she looks like it took 10 years off of her with the fractionated CO2. Look at that picture right there. I mean, it really got rid of the lines, the discoloration, and even tightened up the skin around her eyes. It's just amazing. Almost looked like she had, you know, Botox there, because it gave her that nice lift. And go ahead.
Oh, sorry. The combination treatment especially has given amazing eyebrow lift as well as the eyelid tightening. So the CO2 alone has given us amazing eyelid rejuvenation, and on top of that, when we do the Ulthera on the brow area, it's given even better results.
And so when you say recovery time for both procedures, let's say somebody wants to do both, it's more the fractionated CO2 that's going to give you the redness and maybe
peeling.
might not, a little peeling where you might not want to go to work for a few days, right?
For about 5 days.
5 days. So you require maybe a week off, but then that's it. And you walk out the door with beautiful skin.
Yeah, I've had patients that go back to work on the 5th day. So if you get it done on Thursday or Friday, you just take a day or two off, and by Monday you're ready to go.
Wow, that's phenomenal. And I know you have some great specials, so tell us all about them.
Yes, and first of all, I wanted to thank you, the Atlanta and Company audiences, for amazing response that we've gotten at the open house a week ago.
Well, you know, I planned to go, and then I saw it was at 11 a.m. In fact, I called Carla and I said, I'm bringing my mom. She's in town. Carla's like, it's at 11. I was like, darn
we'll
it.
do it another time for you.
Do it another evening time for all the people that missed it. But I'm glad you had a great response.
So we have decided to extend that offer.
Great.
So if you call and make an appointment today, you will be getting the same deal as the open house, which was $750 off of Ulthera. And if you get the Ulthera, the CO2 will be 50% off.
Phenomenal. And just to give everyone an idea, Ulthera runs generally how much?
About $3,500.
So you get $750 off, and then if you get them in conjunction, you get 50% off the fractionated CO2, which it sounds like it really is the right thing to do. If you have the chance to take a day or two off, get them both and get those dramatic results, right?
Exactly.
Thank you so much, doctor. And by the way, quick side note, you know, this is my month 2 of using Latisse. Hey, will you, Jeff, can you zoom in a little bit? I don't know. I don't know if you guys can see. This stuff is amazing. Call to get the Ulthera, but while you're in her office, I don't know if you can see my lashes. It thickens them so much. These are no fake lashes. And it's so easy. You apply it at night before you go to bed, and you're good to go.
I know. You can see them from miles away.
Anyway, thank you so much, doctor. We appreciate it. And again, if you would like some more information, log on to lasermedskinclinic.com or give them a call at 678-990-4900.